Hello, good evening. How are you? Happy Sunday. Welcome to another session of Ask the Doctor. This program holds every Sunday by 8 p.m. Nigerian time. How are you and where are you watching me from? My name is Dr. Frederick Unwigbohai. I'm a licensed medical doctor. And on this program, we teach, we educate, we answer questions. If you have any medical concern, we always tell you to go to the hospital. We won't treat you online. You have to go to the hospital. But if you can see me and I know you can hear me, tell me, where are you watching me from? Today is question and answer. If you have any question for us, drop it in the comment section and we'll try our best to respond to you. I'm using the word we because my co-host is going to join us very soon. My co-host is Dr. Irobonose Osaze Israel, also a medical doctor. And when he comes up, would respond to your questions. It's based on a first come, first serve basis. And in case you're watching after we have ended, I'm sorry, I might not be able to respond to you. We are streaming live on Facebook, and I'm also live on YouTube. Who is this? Chioma Evelyn. Chioma, good evening. Chioma, how are you? I can see you, Chioma. How you doing now? Okay, who else is here? Now, see, whenever we are doing a question and answer session, people will not ask. By the time we have gone far, they start asking, Doctor, answer me now. So the best thing you can do is quickly drop your question so that I can try my best to respond to you. But if you are looking for any medication here, no prescription here, you will go to the hospital. Is that okay? Uh-huh. Musa, hello, Musa, good evening. And how are you? Emmanuel, good evening. For those who are watching me on YouTube, my YouTube people, drop a comment. Yeah, drop a comment. Look for the comment section and drop your comments. I want to see the people watching me on YouTube right now. I want to see your comments. Let's go. Who is this? Zahara. Zahara, good evening. We are welcome. We are taking questions today. If you have any question for me, you can drop your question. Yes. Let's go. Let's see. Let me see. Okay. I'm checking. Yes. Okay, let me see. Who do we have here? Kehinde Obasanjo. Which of the Obasanjo is this? Mr. Kehinde, how far? Bawoni. Okay, good evening. Where are you watching me from? Good evening, Austin from South Sudan. Austin, how are you? Yes, Dr. Israel is in the house. Oh yeah, everybody tell me, where are you watching me from? Dr. Israel, let me know when you're ready. Faith, good evening. Kongso Philippian. I wanted to say Kasongo. This name looks like Kasongo, yeah. But it's Kongso. Where are you from, Mr. Kongso? Where are you from? Dr. Israel, can you hear me? Hello. Alpha.
Good evening.
Good evening. I see you. Welcome. How you doing now? Dr. Israel, your network is lagging behind though. Help me fix your network. I have a question here. Let me take this question. It says, please, I'm having pains on my right arm and I've gone to do x-ray and the result came out, I'm fine. But I still feel the pains, most especially if I eventually take cold water or drinks. My guy, so your name, Emmanuel. Emmanuel, my question to you is, who sent you for the x-ray? Have you seen a doctor? Because I want to know who sent you for this x-ray. Ima, quickly let me know. You are having pain in your right arm. Your problem might not be reviewed by an x-ray. Do you understand? So I want to find out who sent you for the x-ray, and did your doctor see this x-ray results? Can diabetic patients breastfeed baby? Yes, the answer is yes. Musa, the answer is capital yes, yes. Dr. Israel is back. Kehinde is watching us from Lagos. Dr. Israel network is poor. I don't know what's happening. I can't see him. Good evening. Who is this? Justina from Kaduna. How far now, Justina? How are you doing? Good evening from Sierra Leone. I see you, especially Dave from Makurdi. Somebody says, Doctor, please, is Well Woman a good supplement to be taken daily? Yes, it is. It is. I'm answering you for only one reason, because I have a partnership with them. That is the only reason I'm responding to you, honestly. But it's safe, yes. I hope you've spoken with your pharmacist. Yeah, Well Woman is safe. Yes, and I'm saying this because I have a partnership with them. If not, I will not comment on any brand. You understand? So, Chioma, yes. Good evening, gynecology, Ibrahim. I have a question, Dr. Israel. Your network. One, can hemorrhagic ovarian cyst cause infertility? Can hemorrhagic ovarian cyst cause a woman not to ovulate again? There are two ovaries, so one can be affected, and the other one is very fine. So it will not make a woman infertile. It will not make a woman infertile. A woman can have a very hemorrhagic cyst. You will not even know until it starts giving her severe symptoms. Okay. Somebody says, Doctor, how can I private you? Okay. You cannot private chat me. I don't do private chats on social media with anybody. But if you want to book a consultation, you can book a consultation, you can pay, and then we will talk. But I know they private chat anybody. I don't do that. But if you want to speak with me privately, there is a process for that. You can pay, and me and you we talk. Yes. Dr. Israel, how are you there now?
I did fine. Is the network better now?
Yeah, it's better. I can hear you now very well. Yes, welcome. How family now?
I will thank God.
Okay, divine. Dr. Israel, how far? You hear me?
Yes, I did hear you.
Okay. Let's see. Let's take some questions. So, somebody's asking us a question. Good evening. Please, can you explain what heart palpitation is and the cause of it?
Okay. Heart palpitation is when you start hearing your heart they beat. Normally the heart they beat, but you know they hear them. But when you can't consciously hear the heart they beat boom, 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 and you they hear them. Then that is what now that would they call palpitation. I not suppose. So many things we cause them, ranging from physical activities to pathological activities. Physical like exercise, where you don't run a long place, mostly for those who know the two run. As you stop, they breathe. Sometimes you go to hear your heart a bit boom, 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 boom. Anxiety can cause it. Those when you shock, or you're anxious of something, you feel see the hear your heart they beat like that. There are some medications where physically cause them. Down at their side effects. As they take the medication, some of them, then you feel the hear that heart they beat. Sometimes if person get what they call anemia, that is the red fluid in their body, it don't reduce pass as it's supposed to be. Then because of that, it will give the heart a lot of work. Sometimes you physically on the hear the heart they beat. Or sometimes some heart problem, get some heart pathologies. If you see the heart they beat. So as I said, there are many, but these are just some few, and I think some of the commonest ones when you feel quick when specifically experience. Dr. Fred.
Yeah, thank you very much. If you are just coming, today is question and answer on the program, question and answer, and we will try our best to respond to a few questions. If you never share this video, share the video. If you never share, because I look at the people where they share and we go answer them. A lot of people don't want to share, but they won't ask us question. But yeah, I'll share quickly. Let's see. I have a question here. Let me see. Questions are much. Good evening. Apart from high blood pressure, what else can cause Bell's palsy? I hope you know what Bell's palsy is. Bell's palsy is a condition that affects the face. There are many causes, mostly viral infection, mostly viral, sometimes even unknown. Hmm? Can you hear me?
Your network first disappear. I not hear you before. Let's say you don't come
Okay,
back.
I'm back now. I think I'm back, right?
Yeah, they do. I don't understand. If I win so from my ear.
Okay. Answer the question. Make a fix the
I,
network now.
okay, so for some viral infection, they actually cause bed bed palsy. Yeah, so when they get any injury to the nerves, eh, um, the nerves where they control that part of the face, actually the person will come down with bed palsy. So it's not just only hypertension. In fact, hypertension itself can even cause bed palsy. But most of the time, hypertension will give the person stroke. Yeah, or even diabetic too. But but as I said, some viral infections, injury to the nerves of the face, all those things could cause bed palsy. So somebody puts another comment, and I have some question here. There's one question. Uh, um, this person said, Dr. Fred, uh, they tried to put one question on. Oh. So this person said, Dr. Fred, good evening. I would like you to throw a light on the people saying a stroke patient doesn't take injection. This question they come from Dr. Emmanuel, and he's even a doctor. Before he calls him, we'll talk about more. Just throw light on this thing. You know, say they don't hear and tire. He himself don't tire for that talk. And that's the belief of so many people that once somebody gets stroke, that person not supposed to take injection. I really cannot tell why they think so. Me, I still don't know why they believe say when person gets a stroke, enough you take injection. I don't know why they think, but it is a wrong belief and not be truth at all. If person gets stroke, the person still fit take injection. Yeah, that person fit still take injection. It not mean say because he gets stroke, he not go fit take injection again. And like that person fit. In fact, some of the medication when they give am, they need to still give am through the vein and all that. And those are injection. And so not on because your person gets stroke, you just say no, this person not go fit take injection again. Not be truth, it's not correct. It's not correct. So make we dey guided so that make we for dey do the correct thing. I know they say they come from most of this our older days people. Young ones can't even they carry that belief now, but it's not true. It's not correct at all. So once you get stroke, go hospital. Most people even believe say stroke not be hospital there for the treat am. And these are misconceptions. These are myths. Some believe say even stroke na person they try and give person. Not be truth. You not do the right thing, you go get stroke. You get hypertension, you not take your medication well, you go get stroke. You get diabetes, you not take your medication well, you fit get stroke. If you get anything when go affect your brain, it gives you stroke as well. So, but if you take your medication as prescribed, you no go get the stroke. And if you get the stroke, I beg go hospital, not be outside hospital that they treat am. Go hospital. An injection can also be is also one of the things that can be used to deliver medications to the people wey get stroke. Dr. Fred.
Yeah, thank you so much for that. Okay, I see some questions. Mo, try they fast. Good evening. Can constant exercise really do away high blood pressure? Solomon King is asking this question.
Yes, constantly, continuously, it go help control your blood pressure. However, when your blood pressure is already high, that is, you get high blood pressure, it does not stop you from taking your medication. Exercise na just part of wetin go help control your blood pressure. And e go do that because e go help you lose a lot of calories, a lot of fat, eh? A lot of cholesterol wey suppose go block the blood vessels. So that's what e go help you do. So when you do all those things, the blood go dey flow well, but that does not stop you from taking your antihypertensive medication. It is only when you don't you dey do all the exercise, do every other things, reduce salt intake, drink a lot of water, eat vegetable, then you dey continue to dey do am, you can't go hospital, your doctor come say, your BP dey low, and not take your drug so day, but continue to dey check. You continue to dey check and you notice say the BP no that is only the time you stop. But without it, abeg no stop your BP drug because say you dey do exercise. No stop am. But exercise na part of wetin we dey tell people make dem do to help control your blood pressure. Dr.
Yeah,
Fred.
in addition to that, yes, in addition to that, other things they as well, where they will tell you may you do for blood pressure. Exercise is just one of them. Your diet too, they among waiting you they do, whether you they rest, you they sleep, the things where you they drink, they among them. So exercise is just one out of so many. This person, I'm taking this question for other people here. It says, which medicine can a girl of 20 years take for a very serious infection? Your name now Pretty Didi. You go need to go hospital. There is nothing like serious infection, very serious infection. Infection is infection. The type of infection, the location of the infection, the severity of the infection, the medication where they go give you is tied to so many things. We no go come here, can they tell you may you go buy medicine? No, no, no. We don't do that here. Here, no be hospital. Now your doctor go see you first. Go come find out what they do you. All the medicine where you don't drink. Because some people, before they come hospital, they have taken a lot of medications. By the time they are coming with either resistance or complication. Your doctor will find out many things. Now then they will come tell you what you go do, the test to do, and the medication. Not coming on the internet and trying to treat serious infection. Yeah? Okay. Let's take this one before we go back to Israel. It says, what causes consistent fatigue?
So when you dey tire always, sometimes you want look at the job wey you dey do. Sometimes you need to go do a very correct, proper checkup for your body, because anything fit cause am. The job wey you dey do fit cause am. When you dey get, if your blood level for body don reduce, you fit dey get fatigue. You get malaria sef, e fit continue to give you fatigue. If you get some kind of cancer for body, in fact, all the kind of cancer fit give you fatigue. And so that's why you need, if you get heart problem, you fit dey get fatigue. You get liver problem, you fit dey get fatigue. You dey see even kidney problem, you fit dey get fatigue. So because of that, say many things can give you that. In good make you go hospital so that they can do the general checkup for you. If maybe you have not been able in your brain tie one thing to the fatigue, may they do a general checkup for you so that may they for fit pick out whatever they cause. And if you be old person, you don't old, naturally once person don old, e go dey tire on time, so that one fit still join. Say, but as I said, go hospital for general checkup, general investigation. With that, they may be able to point out this particular one when they cause your own consistent fatigue.
Okay, Ima says, before I went to the doctor, I was administered drugs by my pharmacist, which he said from the drug he administered to me, one for arthritis and so on, but I still feel the pains after a few weeks after I'm done with the drugs. This was before he asked me to see the doctor. And I'm just 26 years old. So, Emmanuel, I don't know how bad your pain is, but please, I don't know how bad it is. I think you should follow your doctor's advice. There is something your doctor told you to do. Please do so, especially if you notice that the pain is very severe. Please follow your doctor's advice. Okay, let's see. My urine has been splitting into two. What does that mean? Oh, okay. Oh,
E no mean anything. E mean say you no dey bring your John Thomas come out where dey urinate. So just drink a lot of water and make sure you are urinating very well. And another thing, make sure say you never get any infection in the past that
okay.
might have
I think
caused
I think this
um
question are set up. I feel this question are set up because this guy go don't go check a lot of things before people ask. See, let's be frank with ourselves. Before people ask questions, 70% don't check Google, 60% don't check Chat GPT. They don't check, and a lot of the thing where they see
yeah,
they
yeah.
confuse them. So it's not as if they have no idea. They know this guy if he gets one or two things they in mind, but he's so I'll prefer what be your name? Your name now Remedy. Please be straightforward. Tell us exactly what you know about this because normally when urine they split into two, it's not okay per se because Dr. Eze was mentioning something. uh That thing they cause urine to split into two. But most guys don't want to come plain. So if your urine they split into two as a young man, and you know, say you don't they do you for a while, a long time, let's be frank with you, hurriedly enter hospital quick. Please. It's not something we want to
Go
joke
see
with.
urologist.
I beg, see urologist. Honestly.
Where you not gonna go get urine retention before you know wetin dey happen.
You can't go develop stricture. Please. What of someone
Yes,
with
na friction
cystitis?
don dey happen small small.
What of someone with cystitis and have used antibiotics but yielded no results? Also, Dr. I beg, respond, I beg.
But I don't know the antibiotics when you use, and I don't know how you take know say you get cystitis. But I will advise say you need to see your doctor. Let your doctor be the one to examine you very well, check the organs, and make them know what they will likely do for you. Yeah. So no just go to take medication anyhow, because sometimes all those medication you take anyhow may not likely work for you. And you may be surprised that you don't have cystitis, or maybe you had it before it has it has cleared off, it has healed. Maybe there's something else they do you now, which you never can tell. So please visit your doctor, and not use drug anyhow. And because some of us don't over abuse antibiotics, sometimes when we not give these antibiotics for the real purpose, sometimes they can't work again. And then we can't see antibiotics resistance everywhere. So please visit your doctor and let your doctor talk to you very well on what and what to do.
Yeah. Now my daughter remind me of your program. Oh, I don't forget. Hello, ma. Good evening, Madam Oluwatoyin. Good evening. Thank you. Greet your daughter for us. Now, why the people on YouTube are not commenting? I can see some people watching us on YouTube. If you never share the video, kindly share quickly. People on YouTube, we are not seeing your comments. That is why I'm not I'm not reading them all. Please. Okay, I'm checking comments. Let's see. The person says, what is the cause of a sore throat lasting for more than a year?
when it doesn't last for more than a year, that's a chronic
We can't hear you. I can't hear you. Dr. Israel. Sore throat lasting for more than a year is no longer ordinary sore throat. I don't. What's your name? I can't even find your name again. Sore throat lasting more than a year is no longer ordinary sore throat. That sore throat needs detailed. I'm using the word. Dr. Israel, are you back? Okay. Hello. Okay, you're back. Yeah. Yeah. Okay. Good. Continue, I beg.
problem. Okay, that's sore throat, and they need to examine them very well, and they need to check you very well, and because you can be from infectious disease, eh, to malignancy. Yeah, let's leave it like that. And it can be something infectious. It can be something that is more than that, and it can be chemical bonds as well. Eh? So it means say you need a proper investigation. They need to check you for hepatitis, check you for HIV, check you for different infections, and check most organs for your body. Check your immune system. Your immune system is very important that they check it. Want to check whether you get APC plus. I don't mention many diseases now, so they need to check all those things, um, so that make them know what is causing the ulcer. Okay, whether not just normal ulcer, they go say no. I say want to check, is this ulcer not cancerous or is just is benign? They go see no, they go see final, because this thing don't they chronic, don't they your body for more than a year. So it's not something you just overlook, not be something where you go lick orange put or lick of vitamin C only put. Okay, Dr. Fred.
Okay, thank you. David is asking. David, are you here? Can diabetes be revised or reversed? Okay, that's your question. Reversed. That's the question you're asking. Currently there are so many conversations and so many discoveries coming up right now with reversal of diabetes. But the people who are mentioning this reversal, I hope they are giving you detailed information, because at the very early stage, yes, there's a doctor who is very um, knowledgeable and has dedicated all her life into lifestyle medicine, obesity, and diabetes. A Nigerian, very elderly doctor. And as part of her work, she has been able to help some few people reverse their diabetes, but it's not everybody. For those whose diabetes has gone very far and the type of diabetes as well. So you can't just come out and say, if you have diabetes, I can reverse it. What type of diabetes do you have? What is the stage? Has your all your beta cells in the pancreas been burnt out? Because if all the beta cells have been burnt out, there is no way you can correct it. Your insulin, you won't have insulin again. You understand? So this is why it's possible to reverse, but not a blanket statement that you will give everybody with diabetes to reverse. So it's an individual based management. They might look at you and tell you, oh, it's very possible you're at a very early stage. We can change your lifestyle and a lot of things. Yes, possible. But for some other people, it's almost impossible. Do you understand? Yes. And Dr. Israel, you want to add anything on top of that?
It just be like hypertension. Hypertension in pregnancy, shey dey reverse. For some people, it go reverse, but for some people, it not go reverse. Even diabetic in pregnancy, it dey reverse for some people, but for some people, it not go reverse. So all these chronic disease, some of them are just like that. Uh, as Dr. Fred talk now, based on individual. And so it's not. I may even want to tell you that if the person get type 1, forget it. And a type 2 diabetes, we feel they think about lifestyle modification, we can help you, can do all those things, but it's not 100%. It's not 100%, and it's not for everybody.
Okay, you've heard that. There's a comment here. Betsy, good evening. It says, good evening, Dr. Fred and Israel. Can you please make a video about deworming? Yes, now. I don't do video about deworming since. Abi, you know what, I made a video about deworming. Yes, Betsy, eh? Ooh, I have. How are you doing? I don't want to Joshua, I don't want to take your comments. I don't want them to flag this live session. Joshua Danjuma, I'm sorry, yeah. I'm ignoring your comments because I don't want them to flag this live session. Okay, Onome is asking, good evening. If a virgin does surrogates and UCS bets and you see a dead the child, can she remain a virgin? Oh God of heaven.
Okay, the first question now is that when you say surrogate, and you know, say they carry another person picking, yeah, that's it. But the first question is how they want to put them for inside your body. Have you ever thought about that? How they want to put them for inside your body. So first thing that one first, then you now ask yourself, will I still remain a virgin then? So first thing that one first, now that one be the first thing when you think. But if you enter the body, you do all the normal, all what you said without touching that area. Yes, you can still remain the virgin. But you should know that virginity is not only removed by through mekwe. There are other things that can actually promote your virginity. So you should also know that. Yeah, you should also know that. Mm. But yes, if everything they do, they not go through that area, they not touch your what do you call them again? Emina. They not touch any of those, they not touch that part. Yes, the person can still remain a virgin.
Okay, thank you. If you have not shared, if you're just coming, this particular program holds every Sunday. In case you watch us for the first time, every Sunday, 8 p.m. to 9 p.m. And we don't do them for 6 years now, every Sunday. May you not forget, if you come late, you go miss a whole lot. Today, we take questions and answers, and we try to answer. But I noticed that some people, they ask questions, that they find treatment here. No, no, and no. We know they give treatment here. I use God name beg you. If you they sick, you go hospital. You go see doctor. Doctor go check you. If anything no clear for your eye, where you no understand, you ask, we go explain to you. If you want, maybe throw more light on something, fine. But if you they find treatments, oh, which drug I go drink? No, we no go answer you here, because we know they do that one here. You go enter hospital, made and check you. Is that okay? Hmm? Very good. Let's see. What can cause cough for more than 2 years?
So if you they get cough for more than 2 years, I don't know if it's recurrent or whether the cough just did there. One of the major things will be allergy. Allergy can be the reason why you get cough like that continuously. So you need to look for what is causing that allergy and remove it from there. If you get cough for more than 2 years and a TB, that person you go do almost one go. Yes, people can have cough for like that for TB, and you go they see some other symptoms they join up. That's another thing. Then and there's another disease, bronchitis, when they give cough to the person can have cough for as you just they get cough. And if it's not properly treated, the person continue to the cough. So anything when it cause problem to the lungs and can actually give this person cough. But for that, as long as 2 years, most of the cough like that will be allergic cough. Yeah, will be allergy. Dr.
Okay.
Fred.
Our people know they share this live session. I think I make I find those we don't share. So now only those we don't share, we go they take their questions. You understand? Some people believe that because we are here, this live session we they cash out, but they no one support us. So what we can do is maybe we find only those where they share the live session and answer their questions. So they check all the names of the people where they share right now, because they show love. Why? Let me check the names. I'm checking the names. Only 26 people. Only 26 people. 9 don't share. this live session. Okay. I mean type 1 diabetes. Dr. Israel, I better respond, I beg, eh?
I think I will answer that. So if you get, we said if it's type 1 diabetes, not they think about reverse. The reason why would they say not the thing, because type 1 diabetes, one of the major thing, one of the problem of type 1 diabetes, now we say there is no the beta
Insulin.
cells are bad, and there's no insulin. So if there's no insulin, there's no way you can do anything. That is why most of the time they give insulin direct. Now insulin that they give, they know they say, may we give medication, make it come bring out insulin from where in all day. So waiting all day, not day. So how you want it reverse waiting all day? It's not possible. Yeah, it's not possible because it's like a genetic thing. So it's not possible. Now only type 2, yes, type 2 you may be able to reverse. Listen to my word though. I not say yes, you will be. I not say will. I say may be able to reverse it. Type 2. That cause it depend on the stage where that type 2 day. And I go cause you if you can know whether you go feel reverse or you not go feel reverse. But once there's no insulin, or there's a problem with the pancreas itself, a genetic problem with the pancreas itself. When the pancreas, now they give the insulin. So there's a genetic problem with that pancreas. When company say no go fit give insulin, then there's nothing we can do about it. Except you want to go find person pancreas good for the body. Dr. Fred,
Yes, thank you so much for that detailed
you
response.
mute yourself. Okay.
Yeah, don't come out time. We have answered you now. What is your name? Your name now, Solomon. We have answered you. We responded to you since myself and Dr. Israel responded to you, Mr. Solomon Novex. When I delivered my baby April 2024, I was having pain from my neck down to my waist. This persisted at times from my waist to my leg. I went to the hospital and was asked to conduct an X-ray. The X-ray says there is straightening of the cervical spine due to pain. However, vertebral discs are preserved. The X-ray concluded muscle spasm. So, doctor, since that time, I can't sit up for long. I can't sit for a bike. I can't sit for bike to a far place. I do feel stiffness and at times muscles at the neck. Okay, so what's your question exactly, Felicia? Quickly, tell us quickly. I have an idea, but tell us your question. Doctor, please, is it possible to reduce weight when you have PCOS? Dr. Israel, I beg respond.
Yes, it is possible. Yeah, it is possible for you to reduce weight. And just keep to normal routine weight reduction principles, and you can actually reduce your weight. If you not reduce 100%, but yes, you will cut down most of your weight as you do your normal routine weight reduction protocol.
Please, I wish to know if it's possible for one's kidney function test to come out well and still have kidney problem without knowing. Second question, can acid reflux cause chest pain?
And for the first question, yes, your kidney function test can come out fine while you are still having kidney issue, because sometimes at the early stage of kidney problem, when you are the kidney just new start to dey spoil, it may not show anything in your kidney function test. Your kidney function test may just be still showing normal. Sometimes you only just notice. Yeah, so as at that point, nobody thinks that your kidney is having problem, whereas your kidneys already your kidney already they get small issue for itself. Yeah, so yes, it is possible. Now only when the kidney don't they go, it don't really they go well, then the result will come change. Then the result will come change. Then you can't say yes, problem really dey well for the kidney. Now for the second question, if acid reflux can cause chest pain. The acid reflux can cause epigastric pain. Yeah, it can cause epigastric pain. And most of the time, most people they confuse epigastric pain for chest pain. Yeah, because it's almost close to the chest there now, under the chest somehow. So most of the time, people they think say now their chest they pain them, whereas now the epigastric region now in they pain them. So yes, it can cause epigastric pain for people. And so if you come be saying that chest they pain you, you need to find out whatever they cause your chest pain, how the chest pain they be, wetin dey trigger the chest pain. Then the doctor will be able to find out which organ within the lungs and the heart they get the issue. Dr. Fred.
Yeah, thank you very much. Before I continue, I see a lot of people they follow me a lot. A lot of you they follow. Thank God, God don't help us. We don't grow up to 1 million. And a lot of you they post on the internet. A lot of you they make mistake. A lot of you they damage your page. A lot of you they post my videos, and my videos they give a lot of people problem for their page. I they beg a lot of people not they post anybody video for your page, but they know they understand many things they to learn. Everybody want to do content, they want to make money, but they forget that there is a process. So if you're a man, a woman, a father, a mother, a grandfather, a grandmother, a businessman, businesswoman, a student, you are self-employed, whatever you do, and you want to learn content creation, go and get my course. May it help you. Get the course, may it help you. Many things there inside will help you. Many things will guide you. The secrets, whether you go feel make money, how long it will take, many things to do. Get the course. Scan this code, it will help you. Now me do am. Now me do the course. I know they bend my mouth, and you go pay to get the course. Please, if you know, say you don't want to learn anything about content creation, be careful how you they post online. May your page no go spoil. So get this course, and if you want to get it, let me know. I can give you my email, and my admin go help you so that you go fee pay and you go get the course. Don't miss it. Doctor, please, what can cause ingrown hairs and boils?
I don't understand this question. Ingrowing hair and boys. Ingrowing hair where? And boys, your environment can cause that boy. What anything when you change water self can cause boy. So most of the time we see that dirty they cause boy. So sometimes dirty then because those dirty go introduce some kind of bacteria for your body, and that can actually lead to boys. And as I said, if you change water, maybe the water when they use to the bath now, not be you fed they use, it can actually lead to blockage of all your pores, and sometimes those boy go start. But that ingrowing hair, I still cannot understand and that. So I think Dr. Fred can say something on that.
I think my knowledge of your question is limited. So when somebody say they get ingrown hair, are you saying the hair for your skin when no gree come out? You know, some people instead of make their hair grow straight, the pore go block, the hair no come out, the hair go grow inside, con they cause swelling. They will con need to open that place and bring out the hair. So those ones now the pores, when the pores block, you understand? Some people like that, you get how they pick their hairs, or they cut their hairs, or they shave. Some ladies and even men, when they shave, the way they shave, if the hair they grow, if you make them get all those things because ingrow. I don't know if that is what you're talking about, or if there's another ingrown hair. But if that is what it is, then you need to be careful how you shave. You need to take notice of how your hair they grow. If your hair they go straight, you don't have to cut your hair going back. So there's a whole lot about it. But now when the pores don't block. Doctor, my question is it safe to get pregnant while experiencing muscle spasm? Any medical advice to stop the pain? Felicia, this is a very good question. The truth is that you can get pregnant. Is it safe? That question is relative. We don't know how bad it is. I think your doctor would be in the best position. You can get pregnant, but you know that pregnancy normally they cause waist pain for most women. You know, most women when they are pregnant, they complain of waist pain. So if you're having this kind of waist pain, it means that during pregnancy, the pain might be worse. Your doctor would be in the best position to guide you. Oh, would you be going for physiotherapy? Would you be going for recurrent massage to help you? Would you need to be on bed for a long period of time? These are things to consider. I would encourage you to please speak with an obstetrician, doctors where they manage women, we get belly specialists, so that they go check you and see the severity of your waist pain and how the pregnancy will affect the waist pain and how the waist pain will also affect the pregnancy, the both of them, and how they could help you, or you can still get pregnant. Okay, let's see. Please share the live session. Doctor, I'm having bloating. What can be the cause? Dr. Israel, okay, your light is down. Dr. Israel, do you hear me? I don't, okay, I think he has, he don't mute himself. So many things can cause bloating. The common cause of bloating are diets. The very common one. Get what you go chop, we not just today okay with your system, and then you get gas, you know, go one digest. The other thing where they cause bloating now, when somebody we get microorganisms, they be like small, small things, you cannot see them. Then they every part of our body. You get how they go they inside your stomach area. They go plenty, they will cause you to they produce gas. You understand? Your lifestyle too. So when you develop bloating, we go find out what in cause them. For you, is it food? If not food, we go advise you take water and take fruits so that you feel go toilet. Because if you go toilet, you go pass out the gas, you go pass out poo poo, and you go day fine. You get how you go day so bad. If you can't give you something where you go drink, the very common one, very popular one, which people know, they go pour for water, you go do. I don't want to call the brand name. You get why? You go put cup, put water, you go open and you go pour inside the water, you go do. You go take them, you go help. So it depends on your own. Bloating, they happen to almost everybody at different times. Don't do me as well, but not be waiting the big deal. But if you notice say your own bloating, they always they come, whether you chop or you no chop, that one you need to see a doctor, make them check you, because recurrent bloating too might just be a sign of something going on in the system. Okay. Dr. Israel, you there? Doctor, answer us on YouTube. Your question on YouTube, no, they come up quick now. Facebook plenty past YouTube. Just they drop your question, we comment. Try see. What can be the cause of the down part of the teeth to change color as if it is decaying? Meanwhile, the person is brushing every day. Just go for scaling and polishing or see a dentist.
Go for scaling and polishing.
Just go for scaling and polishing. Maybe you go put your teeth.
Go for scaling and polishing. Say us.
Continue.
So when you go, okay, you need to go for scaling and polishing. Sometimes you may be brushing, you think say they brush. Some people they brush and they know they brush very well. Yeah, they brush every day, but they know they brush well. So you need to go for scaling and polishing at least twice in a year. That's once in every 6 months, or as the case may be. So when you go for scaling and polishing, they go help remove those are those are still dirt. So they will help remove. I don't forget what they call those dirt. They'll remove them, come off from the teeth.
They call them plaque.
And before you know,
plaque.
those parts go. Yes, the plaque. Yes, plaques. So they'll help you remove one, and before you know, that part go change, and it may not change immediately because if you don't take for there, if you don't even decolorize those part of the teeth, but with time, you will get it right.
Okay, we are almost out of time.
Yeah, Dr. Fred.
Okay, yes, yes. Some questions there. Yeah, Anna says, can polycystic ovarian syndrome cause bloating?
Okay, and Dr. Fred talked something. He said when bacteria dey inside the belly, when they release gas, it will lead to bloating. So polycystic ovarian syndrome, not just only bacteria, when there's any condition within the stomach, when they release some toxins, some toxic uh, things, when the body don't like, yes, if it cause that. That is why Dr. Fresh mentioned one was say once you see say you don't get recurrent bloating, I beg go see your doctor. And I beg go see your doctor. Make they check all your organs and all your kidney. Yeah, so polycystic ovarian syndrome fit be part of what if it cause bloating. If it actually cause bloating, because some of the and some things can be released from it. Even some of your major organs self fit even cause bloating for for some individual when those organs don't they get issue. So as far you don't notice bloating, if you are noticing it almost often, please go hospital.
Now, if you see this comment here, it says, I believe what you said because it comes anytime I eat beans. Yes. Some people now, when they eat beans, some now, when they drink milk, some now, when they eat egg, or when they eat groundnuts, they get so pay attention to yourself. I'm just trying to emphasize more on what Lolo Blessing said and Dr. Israel. Okay, we are almost out of time. We are almost out of time. Let me see. Um, uh, okay, let me see whether we don't miss any question because I just want to be sure. Some people just enter right now, and this comment says, how can someone treat urinary retention? Dr. Israel, I beg, no vex. Help us respond.
If person get urinary retention, na hospital they go. Urinary retention, you know go even in fact, you know go even fit type say you get urinary retention if you get am. So you need to by then you should be in the hospital. Yeah, because they go put something for inside your body when go remove the urine. Yeah, that's the thing. I don't need to come and talk too much, but they will actually put something inside you to remove the urine, and so that your urine no go stay. Sometimes there are two ways they can put it to. Sometimes they can do a little surgery, cut your belly, put am through there. If where they suppose put am pass, e dey block. Eh? They'll cut your belly, put am through there, or not to relieve you from that urine, because urine meant for the bladder come make am dey very tight is very, very painful. Dr. Fred.
Thank you. Urinary retention is an emergency. It's a urological emergency. So, not be waiting you feel just joke with here. Okay, we have to go now. Everybody just they ask us about bloating, bloating, bloating. Now, what? Let me take this last question, Dr. Israel, because of time. This person has been here. Let me see. Let me see. He says, I was given medication for staph, and it affected my head, had pains and confusion, and was seeing double bubble till it stopped, according to the person treating me. But it's still affecting me at my back head, moving down my neck. What can I do? I like this question. Make I allow Dr. Israel answer you.
Go. I dey like give straight answer to questions like this. I know say Dr. Fred go want take each word one after the other, because there's one thing inside there where go make Dr. Fred talk. But me, I know talk. As I earlier, I know talk. I want just tell you. My own is go to the hospital. Yeah, go to the hospital. I must talk. Go to the hospital. Some of you like doing what is in your mind. I don't know who be that person wey dey treat you, wey go tell you stop. Because if na hospital you go, the person go know any other thing wey go do for you immediately when you notice say you dey get all those things. But this one just show say no be hospital you go, and I mean the person just tell you say stop like that, and which is wrong. We keep on saying this thing, that no, you dey treat yourself. self-medication is dangerous. Now they keep people pass. And see they make treatment, not they work for many people. And this one now they make many private facility now they collect money from one hand, from people hand anyhow. Because before you don't go the private facility, you don't go buy zirikuru. Then the doctor wait they no go even know what he go give you. He go come result to go they look for injection when go give you. And then when they give tier B for you, you'll say hospital too dey expensive. Whereas now you just decide to waste your money at first. So please go to the hospital. All those buy many things for outside. One person can't come your house and when no get certificate. Can't they I know where man not talk past that. So please, Oga, go hospital. I be madam.
Okay, oh, thank you very much. We are out of time.
Madam.
This program holds every Sunday by 8 p.m. to 9 p.m. In case you be newcomer here, we don't do one for 6 years every Sunday. For 6 years. So no be today we start. And when we tell you go hospital, we tell you because that is the best thing for you. This idea of I want to collect from different people, no, good. We get our medical license. We know the fear talk. We they tell you waiting go help your life. So please go to the hospital, make them check you. We know they come here because we want you to like us or we they find followers. We don't get power for and time for that one. We are telling you what we help you. So I beg, if you hear Dr. Israel say go hospital, not they jump from place to place. You get why? If you know like your hospital, then not they treat you well. I beg, change the hospital. If you know like your doctor, the way your doctor they treat you, you know like I beg, see another doctor. Nobody go beat you, nobody go vex for you. It is your right. But jumping from places, make people they treat you where you don't know who them be, you not good. That is the reason why we they beg you, say, I beg, enter hospital, make them check you. Sure you understand. Dr. Israel, any final comments as we round up tonight?
Okay. All I would like to say is to say thank you so much for all the questions when you asked, all the questions that was asked. We want to say thank you, and we believe that we are able to answer most of these questions to the best of our knowledge, and we believe that we are able to touch that part where you really want to hear, when we they answer the question. And as Dr. Fred said, when we say go hospital, because that's the best thing we can give to you at this point. We not they treat for year, we not they give you medication for year, and we are not ready to even do it in the next 10 years to come. All we are here to do is just to explain, discuss with you, give you, counsel you, and give you the mind to actually go hospital, go see your doctor. Yeah, so that's the best thing we can give to you. If you never follow us, try and follow us, and no go do you anything. If you just press the follow button, just follow us. You know, do you anything, no spoil your page, make you not see every other people post. At least if you still follow us, you go see they learn more, because all our pages, me and Dr. Fred pages, we get so many talk, we get so many teachings. To the extent say some of the question when you they ask, we don't already do video put. Because if you have listened to all those videos, you may not even come and ask question again. And because we don't do a lot. In fact, this program now it come like repetition. It come like say we dey even repeat what we don't talk before, what we don't do before. We dey repeat them over and over and over again, so that make we they understand, so that any new persons will join us go they understand, go they learn. And that is why we keep on doing this. So thank you. All the time we will say thank you. We not take you for granted. When you take come here, spend your data, we not take you for granted. So thank you so much. Dr. Fred, thank you.
Yes, thank you so much, everybody, for joining us. Not forget, every Sunday, 8 to 9, we have to go. We are very conscious of your time and our time. We beg you, please speak with your doctor. Be mindful of what you take, and we'll see you next week by the grace of God. If you know, say you never get the course on content creation, this one is not beg. If you never get them, go get them. If you dey post video online and you know, say you don't post any of my videos, I use God beg you, whoa, biko, jaw, don't want laugh. Delete them. My admin go strike your page. I beg you. There's a reason I'm begging you. You have to learn these things. So go and get the course, make it help you. May you not lose your business page. Like I always say, good life now waiting. Good life. That sense. Take care and have a wonderful week.
Precious,
Bye-bye.